As we know that dialysis patients are going through lots of ups and downs in their life, hence counseling is not a task to be taken lightly. In the next 5 minutes, we will learn how to do effective patient counseling in a dialysis setup. To do so, the key points are introduction, procedure explanation, identity check, time allocation for counseling, counseling for patients and attendants both, balancing counseling approach, counseling on related procedures, frequency of dialysis, viral marker tests, monthly tests, diet counseling, fluid restrictions, anemia and erythropoietin, creating a supportive environment in dialysis setup. So let's get started with Dr. Yasir.
Hello everyone, I'm Dr. Yasir from DCDC Kidney Care. Our today topic is patient counseling. Why patient counseling is important? We have to make understand patient about the importance of dialysis for his well-being, to make him understand about the procedure, diet and the lifestyle modification he has to do after he come on dialysis. When the patient become informed about the procedures, he can actively take part in the disease management that will help in the better outcome. Now let's talk about some general instructions that we have to understand while counseling. You have to satisfy the patient about the treatment and make him or her understand about the dialysis procedure. Always confirm the identity of your patient by the blood reports, prescriptions and some general queries. Always take your time when you're counseling your patient. You can counsel your patient and their attendant at the same time, or you can counsel them separately also. It's not a single day process that you have to counsel your patient. On regular basis you have to counsel your patient on different dialysis sessions. Always remember, you have to balance your counseling when you're talking to the patients. Never leave the topic, explain all the topics, nor over counseling them the topic so that the patient can be afraid of the dialysis. Responsibilities of dialysis medical officer or technicians. They are the two persons who counsel the patients on regular basis and on the first dialysis. Whenever patients come to you, you always explain them that what is the dialysis procedure, and it happens twice a week or thrice a week, and the duration should be for 4 hours, consequences of missing dialysis sessions and dialysis reuse policy. You have to explain them for the vascular access that for the temporary access we can use central line, and as a permanent procedure we have to use AV fistula or permacath. As a new patients come to our center, we always do their viral markers that includes hepatitis B, hepatitis C and HIV. And regular basis we have to do their CBC and KFT. Also advise him to do periodically blood test like CBC and KFT. Diet is very important part for dialysis patients because diet is very different when the patient is not on dialysis, and diet become opposite when when the patients come on dialysis. On dialysis they have to take high protein diet, and before dialysis the protein diet is very low. Fluid restriction is also a very important part. Most of the patients who are on dialysis, they are not have good urine output, so we have to restrict them for fluid intake also. We also have to explain them about the anemia part. As we all know that all the dialysis patients have low HB levels, so we have to explain the patients that with some injections and some iron supplement that HB level can be corrected easily. Now take home message from this video. Explain your patient in such a way that the patient don't be afraid of the dialysis. Try to counsel your patients on regular basis on each sessions. Explain the importance of dialysis for the better health. And always explain your patients that never miss the dialysis sessions, that can be create a big problem for them. If you have any questions and queries regarding this video, you can always connect with the DCDC Kidney Care team. We are always there to help you. Thank you so much.